Hi everyone and welcome back to my channel. Today we'll be discussing about the peritoneum. Peritoneum was actually a really tough topic for me to understand during my first year of MBBS. Firstly, to have a better understanding of the peritoneum, we'll have to see the transverse section from the right free margin of the lesser omentum. As you know, the lesser omentum is somewhere over here, and we'll be seeing this transverse section. Okay, see there's the parietal peritoneum, which is connected with the abdominal wall. It runs backwards, and from the over here, actually the retroperitoneal organ, the left kidney is there actually, and from there it reflects up. Reflects anteriorly and surrounds the spleen. Okay. After surrounding with the spleen, it then goes on to the stomach, and then it covers the anterior part of the stomach, and then the peritoneum actually goes and covers the liver. And instead of going directly to the liver, it makes a fold. And covers the posterior part of the stomach and the posterior part of the spleen, and then runs behind to the posterior abdominal wall and surrounds it, and then comes again forward and near the bad area of the liver. It bends towards the liver and surrounds the liver also. So during these bends and folds and all, there are certain paths, certain canals like things which are present between these viscera. So the first one we'll be seeing is these canals can be called as a ligament, because it actually connects certain viscera. So the first ligament we'll be seeing is the Linoren Ligament, because it connects the spleen, and over here it should be the left kidney. So it connects both of them. And when there's a canal, there has to be some sort of a content inside it. So what supplies the spleen? Splenic artery. So yeah, the content is the splenic artery and the pancreas. You see, the pancreas is actually not a peritoneal organ, but the tail of pancreas is. And then the next one we'll be seeing is the Gastrosplinic Ligament. As the name suggests, this ligament attaches to the stomach and to the spleen, and the contents of it are, if you can visualize what it is, that you see the liver is in the right hand side of the body, and this stomach and spleen is towards the left hand side of the body, right? So since it is in this ligament itself is in the left hand side of the body, so we can see the left gastroepiploic artery and the short gastric artery is present. The next ligament we'll be seeing is the Falsiform Ligament, which holds the liver and the anterior abdominal firmly in place. And one of the content is actually another ligament known as the ligamentum teres. You see this lesser omentum, it is actually a double fold. It is a double fold of the peritoneum, which is between the liver and the stomach. Okay, this actually connects the greater sac. This makes a connection between the greater sac and the lesser sac. So but the canal or the foramen through which there is a connection is the epiploic foramen, but it is made, that foramen is made by the lesser omentum. Okay, this lesser omentum actually has two parts. First one is the free margin, and next one is the attached margin. And all these things have certain things or certain contents inside it. See, the free margin has the portal triad. The portal triad is the portal vein, the hepatic vein, and the bile duct. and the attached margin contains the right and left gastric arteries. Okay. The next we'll be seeing about the epiploic foramen. This epiploic foramen is the one which connects the greater sac and the lesser sac. So when when there's an internal hernia, for example, the visceras, or you see the visceras present over here in the greater sac, come to the posterior side, pass to the lesser omentum, and then via the epiploic foramen enter into the lesser sac. Okay. And this this hernia is not that easy to treat actually, because this epiploic foramen is actually present behind the right free margin of the lesser omentum, and during these hernias and all, the substance or the viscera has to be pulled out. For that, the foramen has to be increased in size, right? But increasing the size of the epiploic foramen is practically not possible. Why is that so? Because you see, in the top and in the right hand side of this foramen is the liver, itself. In the below part, or there's the epiploic foramen, for example, epiploic foramen. Above and in the right side we have the liver. Below we have the first part of the duodenum. We have the stomach, and we also have the the pancreas and these important portal triads and all that. So it's kind of hard to treat it. Let's have another pictorial representation and understand the relationships of the epiploic foramen. So this is the lesser omentum. Okay, this is the lesser omentum, and this thing which I drew before, this part, see, this part is only over here. Okay, and this lesser omentum and this epiploic foramen is present in the right free margin of the lesser omentum, right? This is the epiploic foramen. So what is in the anterior side? Anterior side, that is the portal triad. And to be more specific, the most near anterior is the portal vein, and towards the left anterior is the hepatic artery, and towards the right anterior is the bile duct. Okay, and in the posterior aspect we'll have the inferior vena cava and the right suprarenal gland and the body of the T12 vertebra. On the roof, or on top of this foramen, we will have the liver actually going, and on the floor we'll have the first part of duodenum going. Let's have an image based understanding. You see this part is the epiploic foramen. Okay, and in this epiploic foramen, what do you see? In the anterior aspect we have the portal triad, right? And in the posterior aspect we have the IVC and the suprarenal gland, the body of the T12 vertebra, and on top of it there will be the liver, and on the below side, or on the floor, we will have the first part of duodenum. Some of the organs which we can see here is the liver, the stomach, the spleen, and connecting the spleen and the kidney is the Linoren Ligament. Connecting the stomach and the spleen is the Gastrosplinic Ligament, and connecting the liver to the anterior abdominal wall is the Falsiform Ligament.